Welcome to another informational video from Buy Diabetic Supply. This video will go over the common and important questions that a patient might have about Eliquis. 1. What is Eliquis, and what is it used for? Eliquis is a medication that contains the active ingredient apixaban. It is primarily used to prevent blood clots and reduce the risk of stroke and systemic embolism in people with non-valvular atrial fibrillation, deep vein thrombosis, and pulmonary embolism. Blood clots can be dangerous because they can block blood flow and cause serious health problems. Eliquis works by blocking the action of certain proteins in the blood that are involved in the clotting process, thus reducing the risk of blood clots. 2. How does Eliquis work? It works by blocking the action of a protein called thrombin, which is important in the blood clotting process. When a blood vessel is injured, thrombin helps convert a protein called fibrinogen into fibrin, which forms the backbone of a blood clot. Eliquis specifically targets thrombin, preventing it from converting fibrinogen to fibrin, and stopping blood clots from forming. Unlike other blood thinners like warfarin, Eliquis only targets thrombin, which makes it more selective and less likely to cause side effects. Eliquis is used to reduce the risk of stroke and systemic embolism in people with non-valvular atrial fibrillation. Eliquis is used to treat and prevent deep vein thrombosis, DVT, and pulmonary embolism, PER. Eliquis is taken orally, and its effects last for several hours after each dose. It is important to take Eliquis as prescribed by a healthcare provider, and not to stop taking it without consulting them first. Suddenly stopping Eliquis can increase the risk of blood clots recurring. 3. How do I take Eliquis, and how often should I take it? Eliquis is usually taken twice a day with or without food, as directed by a healthcare provider. The dose of Eliquis may depend on the reason for which it is being used and an individual's medical history. It is important to take Eliquis at the same time each day to ensure that the blood levels of the medication remain stable. 4. What should I do if I miss a dose of Eliquis? If a dose of Eliquis is missed, it should be taken as soon as possible on the same day. If it is almost time for the next scheduled dose, the missed dose should be skipped and the regular dosing schedule should be resumed. It is important not to double the dose to make up for the missed one. Missing a dose of Eliquis may increase the risk of developing a blood clot or other complications. To help remember to take Eliquis, it's a good idea to take it at the same time every day. Setting an alarm or reminder on a phone or other device can also be helpful. It's important not to stop taking Eliquis without consulting a healthcare provider, even if feeling better, to avoid the risk of blood clots recurring. 5. What are the potential side effects of Eliquis, and what should I do if I experience any of them? The most common side effects of Eliquis include bleeding, nausea, and anemia. Some individuals may also experience allergic reactions or liver problems. If any unusual bleeding or bruising occurs or any signs of an allergic reaction appear such as rash, itching, swelling or difficulty breathing, it is important to seek medical attention immediately. 6. Are there any dietary restrictions while taking Eliquis? There are no specific dietary restrictions while taking Eliquis. However, it is important to eat a healthy, balanced diet and avoid foods that are high in vitamin K, such as leafy green vegetables. These can interfere with the medication's effectiveness. It's also important to avoid excessive alcohol consumption as it can increase the risk of bleeding. 7. Are there any medications or supplements that I should avoid while taking Eliquis? There are some medications and supplements that may interact with Eliquis and increase the risk of bleeding. It's important to inform a healthcare provider about any other medications, vitamins, or supplements being taken, as well as any medical conditions, before starting Eliquis. Some examples of medications and supplements that may interact with Eliquis include aspirin, non-steroidal anti-inflammatory drugs, NSAIDs, heparin, and some herbal supplements like ginkgo biloba. 8. Can I drink alcohol while taking Eliquis? It is generally safe to drink moderate amounts of alcohol while taking Eliquis. However, excessive alcohol consumption can increase the risk of bleeding and should be avoided. Moderate alcohol consumption is typically defined as no more than 1 drink per day for women and no more than 2 drinks per day for men. It's important to note that the amount of alcohol that is considered moderate may vary depending on an individual's weight, age, and overall health status. 9. Will Eliquis interact with any other medications I'm currently taking? Eliquis may interact with other medications, and it's important to inform a healthcare provider about all medications and supplements being taken before starting Eliquis. This includes prescription medications, over-the-counter medications, and herbal supplements. Some medications that may interact with Eliquis include blood thinners like warfarin, antiplatelet medications like aspirin, NSAIDs, and some antibiotics. It's important to let a healthcare provider know about all medications and supplements being taken to ensure that there are no potential interactions that could increase the risk of bleeding or other side effects. 10. How long will I need to take Eliquis? The length of time a person will need to take Eliquis depends on the reason for which it is being used and an individual's medical history. For example, people with non-valvular atrial fibrillation may need to take Eliquis indefinitely to reduce the risk of stroke and systemic embolism. Those who have had a blood clot or pulmonary embolism may need to take Eliquis for a shorter period, typically 3 to 6 months. The duration of Eliquis therapy should be discussed with a healthcare provider. It's important not to stop taking Eliquis without consulting a healthcare provider, even if feeling better, to avoid the risk of blood clots recurring. Thanks for watching. iBuyDiabeticSupply.com